Hello everyone, I'm Jo Jingi. Today I'll be discussing Manjaro, generic name, tirzepatide. This is a medication that is currently causing a great deal of discussion and debate, not only in Japan, but across the entire globe. It's being called the ultimate weight loss drug and the miracle drug that lets you lose weight without effort on social media platforms. Because of this hype, personal imports for cosmetic purposes and prescriptions in private medical care are rapidly increasing every day. However, from a doctor's perspective, I have a very strong sense of crisis regarding this situation. It is not as simple as the internet suggests. Today, I will explain, does it really work? What are the risks? And most importantly, what is the essence of medicine? To put it simply, medical data confirms that it does indeed have a powerful and significant effect on weight loss. But we must remember, Manjaro was originally developed as a treatment for type 2 diabetes, a disease characterized by high blood sugar levels. It works by targeting two specific hormone receptors in the body, known as GLP-1 and GIP, which are crucial for metabolism. Let me explain why it helps with weight loss using a simple analogy. Think of this drug as a satiety signal megaphone in our bodies. Normally, when we eat, a signal is sent to the brain saying, "I'm full." It's a natural process that regulates our intake. Manjaro mimics the function of those natural hormones, amplifying that signal many times over and making a strong impact on the brain's satiety center. These receptors are highly sensitive, and Manjaro essentially turns the volume up to maximum, ensuring the brain cannot ignore the message of fullness. This approach to the brain is powerful. Even after eating only a small amount, the brain is tricked into thinking it is completely full. It mistakenly concludes, "I'm super full, I don't want to eat anything more," effectively cutting off the desire to consume calories. The second approach is to the stomach itself. It deliberately slows down the stomach's movement, or gastric emptying. It's like creating a traffic jam at the exit of the stomach. Food stays inside much longer than it naturally should. Because the food remains in the stomach for an extended period, you feel less hungry throughout the day. It's a physical sensation of being stuffed. Large-scale clinical trials overseas, such as the SURMOUNT studies, have shown data indicating weight loss of nearly 15% to 20% after more than a year. This degree of weight loss is unprecedented for a non-surgical intervention, making it a truly remarkable breakthrough in metabolic medicine. At first glance, this might seem like a miracle drug that solves everything. However, this is the most important part I want to convey as your doctor. There is no such thing as free magic in this world. Everything has a cost, especially when it comes to pharmacological interventions. When a drug brings about strong systemic changes in the body, it also comes with equally strong and sometimes dangerous side effects. The most common are symptoms caused by the stomach congestion I explained earlier. That food jam causes real physical distress. Constant severe indigestion, nausea, vomiting, and severe constipation or diarrhea occur in a significant percentage of patients. Some of my patients complain, "I feel so sick I don't even want to drink water." The quality of life can diminish rapidly while on the drug. In more serious cases, it can cause acute pancreatitis, a painful condition where digestive juices begin to dissolve the body's own organs. It can also lead to intestinal obstruction, where the intestines become completely blocked, sometimes requiring emergency surgery to save the patient's life. We must also consider individual genetic differences. For example, gut microbiota can vary significantly, meaning side effects can be unpredictable. What's most frightening is the high probability of rebound weight gain after discontinuing the medication. The effect is often temporary. Since the medication was merely artificially creating a satiety signal, discontinuing its use releases the brain's brakes and the stomach congestion is relieved. Unless eating habits themselves improve, weight will quickly return to its original level. It doesn't fix the underlying lifestyle issues. This leads to a critical question. Should I continue taking this medication for the rest of my life, paying high prices and enduring side effects? The financial and physical toll is immense. Is easy weight loss worth the potential for chronic health complications? Medicine should never be seen as a way to circumvent the fundamental laws of biology. A quick fix today often leads to a complex problem tomorrow. Here, we'll discuss the extremely important topic of indications, the criteria for who should and should not use this drug. In Japan and many other countries, Manjaro is approved specifically as a treatment for people whose health is threatened by illness. While it is approved as an obesity treatment in some countries, this also comes with very strict medical criteria that must be met. They are absolutely not drugs that should be used by people with a normal body type who want to lose 3 kilograms for cosmetic purposes. Using a high-potency diabetic medication for minor cosmetic adjustments is medically inappropriate and potentially dangerous. And now, this is causing a major international social problem. That problem is a severe global shortage or depletion of the drug. As a result of healthy people buying up the supply for weight loss, real diabetic patients are unable to get the medicine their lives depend on. This is unacceptable from a medical ethics standpoint. The pursuit of easy beauty is directly impacting the survival of the sick. Behind someone's desire to become beautiful easily, someone else's life is being put at increased risk. We must re-examine this structure. When demand for non-essential use outstrips production, the most vulnerable suffer. This is a collective responsibility for all of us. Finally, let me share a few of my personal thoughts. In today's society, there is a dangerous tendency to value only convenience and immediate results. There's a prevailing sentiment that effort is uncool and that every problem can and should be solved with money or medical shortcuts. As a doctor, I must say, a healthy body is the culmination of steady accumulation, daily diet, sleep, and moderate, consistent exercise. When we use these drugs for vanity, we are making a choice that deprives a diabetic patient of their primary defense against a debilitating disease. A body that loses weight by forcibly suppressing appetite with medication will lose muscle mass and lose its natural skin luster. It can also become emotionally draining. Is that truly the beauty and health you originally desired? Or just a shell of it? Medicine is a safety net to save people whose bodies have broken down, not a magic eraser to erase the consequences of a lazy lifestyle. True health cannot be bought in a bottle. It is earned through the choices we make every single day. There are no shortcuts to longevity. We must respect the complexity of our biological systems and not disrupt them lightly for the sake of vanity or social trends. When we treat medicine as a consumer product rather than a life-saving tool, we lose sight of its true purpose and its inherent risks. To summarize, Manjaro is a remarkable drug that has brought about a great innovation in the treatment of type 2 diabetes. However, it shines only when used by people who truly need it, under the proper and rigorous supervision of a medical professional. It has a powerful weight loss effect, but this is merely an illusion created by tricking the brain into feeling pathologically full. The risks of life-threatening side effects like acute pancreatitis and intestinal obstruction are real and must be taken seriously. Remember, true health is a symphony of choices: nutrition, movement, and rest. No medication can replace the foundational pillars of longevity. Inappropriate use is a social problem that threatens the lives of patients who truly need the medication. Please consider the global impact. I want you to think deeply about what true health is and how you should approach your own body with respect and patience. If you found this video helpful, please subscribe and give it a thumbs up. Your support helps us share reliable medical information. See you in the next video. Goodbye and take care of your health. Zaijian. Please consult with your own physician before making any decisions about your health or medications. This information is for educational purposes only.